For today, we are reporting on the 3 periods from Friday to Saturday, Saturday to Sunday, and Sunday to today. From Friday to Saturday, we had 713 new cases of COVID-19. Saturday to Sunday, an additional 626 new cases, and from Sunday to today, 594. For a total of 1,933 new cases of COVID-19 over the past weekend, including 11 of which were epidemiologically linked. That brings our total number of people with COVID-19 in British Columbia to 27,407. The new cases by health authority, 414 people, were in the Vancouver Coastal Health Region. 1,304 people were in the Fraser Health Region, 48 people on Vancouver Island, 104 people in the Interior Health Region, and 61 people in the Northern Health Region, and an additional 2 people who normally reside outside of Canada. We now have 7,360 active cases in British Columbia, of whom 277 are in hospital today, 59 of whom are in critical care or ICU. We have 10,200 people under active public health monitoring and 19,069 who have recovered from COVID-19. As we've moved into this phase of our pandemic, our hospitalizations and our transmission in long-term care has increased, and over this past weekend we've had 17 people who've died from COVID-19, bringing our total to 348 people. The majority of these people were seniors and elders in long-term care, and we send our condolences and our thoughts and prayers to the families, to the caregivers. We know how challenging it is right now when we have an outbreak in long-term care, and to the communities of our people who have died. Right now we have 6 new healthcare outbreaks in the North Peace Senior Housing, Queen's Park Care Centre, Care Life Fleetwood, Sunset Manor, Renfrew Care Centre, and Lionsgate Hospital. 2 outbreaks have been declared over at the Nanaimo Regional General Hospital and Evergreen Baptist Care Society. That leaves us with 60 active outbreaks in our healthcare system, 54 in long-term care and assisted living, and 6 in acute care. We now have 970 active cases in long-term care, including 583 residents and 365 staff. And that is a very sobering thought for us, knowing how challenging our long-term care outbreaks can be. And that really speaks to where we are right now in our pandemic here in British Columbia. It is the most challenging of our time, and we are all feeling the strain. This virus doesn't pause, though, when we're tired and frustrated and we want it to be over. And it doesn't pause when we're out with our friends, our family members, those we care with. It spreads quickly and doesn't wait for us to catch up. I say this not to give up hope, of course, because I do think there is hope, but to remind us that we have the knowledge, the tools, and the resources to control this virus and not let it control us. I say this to fuel that fire of determination and resilience that I have seen in people across this province. That when we see these challenges, we all think about what can we do today to make a difference. And right now, that means doing a bit more to get over this hurdle. Over the next 2 weeks, we need to urgently reduce the level of transmission in our province to keep our schools and workplaces open and relieve that very real stress we are seeing right now on our healthcare system. That means reducing our social gatherings, our social interactions and events. Protecting our hospitals, workplaces, and schools is the important thing we must focus on now. We have been learning. It's not the same as it was even a few weeks ago. We've learned that as we've moved into winter, the virus spreads more easily. And we're seeing that across the globe and across the country. And we need to pay attention to that, as we've seen increases in our healthcare system as well. And that is why we put in the new orders that we did last week. These orders that are province-wide orders are very similar to the previous regional order we had put in place in the Fraser Health and Vancouver Coastal, but there are some differences, and they do apply across the province. And to be clear, the new orders supersede what we had in place before. When new orders come into effect, it is not unusual. We get asked a lot of questions, and people want to know, what does this mean to me and the changes to me in my specific situation? And while I want you to understand the new safety measures and restrictions, I'm asking people to focus on the intent of the orders, what we are trying to do together now to address what we are seeing in our pandemic here in BC. So reducing our social interactions as much as possible. That is where we are seeing transmission of the virus, particularly indoors, but it is to those people we are closest with, whether at work, at home, our social family, our social connections. I'm asking you to put the safety measures at the top of your list every day, rather than thinking about where the gaps are, where the shortcuts are, is there a workaround, is there a way I can get around this order? Simply put, we all need to focus on making a difference today. In our homes, we should only be with our immediate household, those people we live with. That means no visits, social visits from extended family or friends. Yes, it does mean you can help your mother if there's a concern. It does mean that you can carpool to take your children to school. It does mean that grandparents can care for children. But what we mean is no hosting of gatherings, no dinner parties, no backyard barbecues, no play dates right now. This next 2 weeks is critical for us across the province. But I do know connection is important, and that's why we've said if you live alone, you can, of course, have those 1 or 2 people that are in your close bubble that you have close connection with, whether that's a partner, a relative, a friend. And of course, we know that there's connections with co-parenting and other important connections. You can also go for a walk, go for a bike ride with a friend or 2 friends. Go outside with your family. We've said this from the very beginning, and it's important that we continue to look after our mental health and our physical health. Get outside, go for a walk, keep your distance. Take advantage of when we can get outside and the places that are in your community to let off some of that concern, to get some physical exercise, to have that time with people. I have also suspended all events as defined in my gatherings and events order. And that apparently I needed some details in it. So with the exception being funerals, weddings, and ceremonies such as baptisms, which have increased restrictions on them. But it does include events at hotels, restaurants, bars, and does include movie theaters and cinemas. I know this has meant delaying the opening of some very great and well thought out seasonal events like the Holiday Train in Stanley Park and the Bouchard Garden Light Display, among many others that had previously been approved across the province. Those are suspended. We need to monitor what we are doing right now and reduce the potential for social interactions. That has meant pausing all in-person gatherings and shifting to virtual services, whether they're religious services, performances, fundraisers. The vast majority of event organizers and venues have been doing a great job and have robust COVID-19 safety plans, and we know they've been working. But we need to take a pause, whether you call it a circuit break. Now, for these next 2 weeks in this province, all of us need to stop these events and pause so that we can get control of this virus. That does not include in meetings such as city council meetings or support group meetings and business meetings, but I would say as much as possible, we need people to take those virtual, to have the ability to do it virtually if you can. And if you must meet in person, and I know there are some reasons why some of these groups, it's important for people to be in person, you must have COVID safety plans in place. It must be the smallest number possible, and you must keep all of those layers of protection in place. So ask yourself, is it a gathering? Is it an event? Is it something that I can do virtually? Can we postpone it? And if it is one of these events, it is not to happen right now. This is in place until December 7th, and we will monitor. We will continue to monitor daily, and we'll be looking at what are the things, where are the issues, what are we seeing where transmission is still occurring, and we will update you as we go towards December 7th. Some people have spoken about this pandemic as a marathon with a far distant finish line. But I've come to think of it really as an Ironman race. I've run marathons, but I've never run an Ironman, where it's not one leg, but 3 different, strenuous, difficult legs. A swim, and then a bike, and then a marathon. We got through the swim, barely, this spring, and we learned. We learned quite a bit. And now we are on the bike ride. And this bike ride has some big hills to climb. And we don't know exactly when this part of the race is going to end and when we're going to move into the next phase. But we all know that while you may have to slow down when you're going uphill, we can get over the top and we can enjoy the downhill on the other side. But right now we have a distance to go, and we don't know yet where the finish line is. The next leg is not quite in sight, which means we need to gather our focus and our energy together now. When vaccines are approved and available, we'll be able to transition to our next phase, to that run that will have a finish line, to get into our rhythm and to steadily move forward. I understand that this pandemic is tiring, and the orders make it more difficult. We don't want to have these things in place. But right now, we need to focus on today. Focus on the intent of what we're trying to do right now, which is stop those transmissions from happening, reducing our connections so that we can get through this phase of the pandemic together. Instead of thinking, how can I find my way around this? Think about your way to stop the spread. What can I do today to make a difference? And remember that we all need to show compassion and understanding and do our part to get through this leg of the race. But we will get through this, and we will do it by focusing on what we can do individually and together, and by being kind and being calm and being safe.
Thank you very much, Dr. Henry. And I wanted to start by saying 17 people died this weekend from COVID-19 in British Columbia, and that's was 4 from Friday to Saturday, and 8 from Saturday to Sunday, and 5 from Sunday to today. 13 of them lived in Fraser Health, and 4 lived in the Vancouver Coastal Health region, and I think I speak for everyone in the province when I say that we send our condolences to families who are struggling with this right now. It is a very, very difficult time to lose a loved one under any circumstances, but particularly due to COVID-19. And every person matters, every case matters, and when we lose 17 people, that is a profound loss for us, one that affects us greatly here. And we want to say to everybody that we are thinking of them and we are with them in this difficult time. I know that people in healthcare are working extraordinarily hard. Dr. Henry talked about the 7,360 cases, the 10,200 people who are self-isolated and under public health surveillance. It is extraordinary, in fact, the work that's being done by people in public health. It's a massive and coordinated effort, and I want to express my appreciation to all of those people. I spent a good deal of time on the weekend, I know Dr. Henry did as well, answering phone calls and talking to people about the orders that were brought in on Thursday. And I think, and I want everyone to know, that I think it's a good thing. I think that the fact that people have questions, that they want to comply, that they want to engage, is a good thing. And I just want to say broadly about these questions the following. That often when we are trying to make changes in public life, we negotiate, we litigate, we compare ourselves with other groups, but that's not what these public health orders and guidance seek to do. They are tools for all of us to help stop this transmission of COVID-19, because we can't negotiate with the virus, which has one goal, which is to transmit. It has one goal. And we can't deal with it that way. There's no litigation to be had. And I think sometimes we lose sight of this in our discussions of these questions. I wanted to just specifically, on the issue of events, reinforce what the order says. And it will take a moment, but I think it's important to look at what the order says. And this has been as a definition of event under the orders. And it refers to anything which gathers people together on a one-time, regular, or irregular basis, including a gathering in vacation accommodation, a private residence, banquet hall, or other place, a party, worship service, ceremony, or celebration of any type, reception, wedding, funeral, celebration of life, musical, theatrical, or dance entertainment or performance, live band performance, disc jockey performance, strip dancing, comedic act, art show, magic show, puppet show, fashion show, book signing, reading, recitation, display, movie, film, meeting, conference, lecture, talk, educational presentation, except in a school or post-secondary educational institution, auction, fundraising benefit, contest, competition, quiz, game, rally, festival, presentation, demonstration, athletic, sporting, or other physical activity, exhibition, market, or fair, including a trade fair, agricultural fair, seasonal fair, or episodic indoor event that has as its primary purchase the sale of merchandise or services, e.g. Christmas craft markets, home shows, antique fairs, and the like, and for certainty, including a gathering preceding or following another event. And that is available on and the most recent version of it, because it's been amended, is available under PHO Order November 10th, page 3. And I think what it says is that what we're trying to do here, and these are all both religious and secular events, of course, of all kinds, except with weddings and funerals and baptism, where we have a maximum of 10 people, which is itself difficult, but that is an exception from the rule. Is what we're asking people to do is to reduce social interaction in this period, that this is one of our means in our calm, considered, compassionate, thoughtful, science-based, and massively resource response to COVID-19 in BC. These are the means by which we together can fight the virus. And I encourage everyone with the orders that were put in last Thursday to see them as tools by which we can do that and maintain the values. And if we're going to think about injustice, think about the injustice of the people that we lost this weekend. Think about the people in long-term care living with outbreaks right now, and all the people working with them and the families involved, because that is injustice, but it's not an injustice that we can fight by getting angry. It's an injustice we can only fight by following the advice and the guidance of Dr. Henry and her team. I have a couple of updates I wanted to bring up today on that we regularly provide, one with respect to PPE. As you know, since March, the following has arrived in BC, or as we announced as of last Monday, November 16th, 7.5 million N95 or equivalent respirators, almost 126,400,000 surgical or procedure masks, almost 2.9 million pieces of eye protection, including goggles and face shields, just over 223,600,000 pairs of gloves, and just over 14 million gowns. Over the past week, the following PPE has arrived in BC: 268,000 616 N95 or equivalent respirators, 4,292,350 surgical procedure masks, 5,100 pieces of eye protection, 11,780,550 pairs of gloves, and 1,023,275 gowns. As I mentioned last week, and this has not been included in these totals yet, as we're working to inspect and sort a huge arrival that came on November 12th, but that arrival includes approximately 43.2 million pairs of gloves, 105,000 gowns, 24 million procedure masks, and 21,600 procedure masks with a visor. And I want to thank everyone involved in doing that extraordinary work and also doing the work to ensure that all of this material meets the test of our public healthcare system and the requirements of the people who work in it. I want to also bring you up to date on our influenza vaccine measures, and this is a good news story in the sense that based on both national and provincial surveillance, that all indicators of influenza activity remain exceptionally low, as Dr. Henry reported last week for this time of the year, despite the increased level of testing. To date, there is no evidence of influenza circulating in BC communities, and no long-term care facility influenza outbreaks have been reported so far in 2021. Just to put it in context, about 2,027,300 doses of flu vaccines have been distributed by the BC CDC to regional health authorities. And just to put it in comparative sense, as of November 23rd, we know that at least 1,069,542 doses of influenza vaccine have been administered in BC. We know that the actual number is higher, but there's a reporting lag of up to 30 days from pharmacists and physicians and other community providers, such as nurse practitioners. But this is, in this context, an extraordinary achievement. And just to give you some measure of comparison in that regard, last year at this time, or as of November 23rd, in the 2019-20 year, 518,025 doses had been administered by pharmacists. This year, that number is 808,001. In terms of doctors' offices, those numbers are up about 100,000 over last year, and of course, a significant number have been distributed by public health. So this is, I think, an extraordinary achievement. So just in conclusion, and I would say, as Dr. Henry has said many times, I think we at our home we use this quote more than anything else, that this time is for now and not forever, and that's true. But now, of course, it's time to take a pause, and it involves, I think, the orders that we've made and the actions we're asking all of you to take that will support public health in its efforts to help people deal with COVID-19. I don't think Dr. Henry would be making new orders if we were immune to COVID-19. I know she wouldn't be. We wouldn't be asked to take action right now if it didn't have an immediate impact on our health, our safety, and our future. And you can see this week how clearly that is. We certainly wouldn't have asked to make this sacrifice if it didn't save lives. You can't barter with COVID-19. It doesn't, there's no litigation launched by COVID-19 as to whether it infects us at one age or another. There's no arguing with COVID-19 as to whether it deserves to enter our household or someone else's. There's only a virus that seeks to thrive based on our humanity, our need to connect, our desire to gather, our nature to share. Our all good things. All of the events I've listed, or at least just about all in the event order, are things that make our society, our life more worth living. They're the things we do together. We are social beings, and all of them, when we do more of them, tend to be an example of broader public health. It is a difficult time, but we must use the skills we've been taught. We must follow the guidance we've been given. We must fill the promise of the orders we have put in place to help keep us safe.